It's our tradition to have two speakers at our graduation ceremony, one from outside the university and the other representing the graduating class. It's my honor now to welcome our first speaker, Dr. Deborah Gould. You can find a detailed description of Dr. Gould's accomplishments in the program, where you'll see that she has more than 20 years of hands-on experience at the Centers for Disease Control and Prevention. She specializes in program planning and management, health education and training, and public health program evaluation. Dr. Gould participated in the CDC's emergency response activities in 2001 anthrax attacks, the 2004 SARS pandemic, the 2004 Indian Ocean tsunami, the 2009 H1N1 pandemic, the 2010 Deepwater Horizon oil spill, and the 2004 Ebola epidemic in West Africa. She's a double dog, having received both her master's and Ph.D. from the University of Georgia. So please join me in welcoming her back to Athens.
I'm glad y'all are a fun crowd. So, okay. My speech is only about 10 minutes, but y'all are so fun, I might have to make it a little bit longer. So, okay. Well, anyway. So, good afternoon. Thank you, Dean Williams. Thank you to the faculty, the staff, parents and guests, and of course, you graduating students. I really am honored to be back in Athens and to share this important day with all of you. As mentioned, I do work at the CDC, so as a federal employee, I do have to provide you with the requisite disclaimer and let you know that the views that expressed by me here today are my own and don't necessarily represent the CDC or the U.S. government. So now that I've gotten the required formality out of the way, I'll go ahead and get started. So my first comments I want to actually say to the parents out there. As mentioned, I did graduate from the University of Georgia with a master's and Ph.D., actually in psychology back in 1991. That was before there was a College of Public Health. I then began my career at CDC, public health career at CDC in 1995, and I'm still there. But if it wasn't for the education that I received at UGA, I would not be standing here before you today. So I want to assure all of you parents here that the education that your son or daughter has received from UGA is well worth the investment that you've made. So all those tuition checks that you've written each semester, it's worth it, trust me. You're gonna get your money's worth. So graduates, you made it. You made it. Yeah, okay, right? That's right, okay. Right, so. And welcome to the public health family. So I'm really excited for all of you because you're about to enter a field that has great value to our society. And it has great value because public health workers work to improve the health of the public and not just those who can afford to walk into a doctor's office. You're going to have a chance to improve the health of people within your own communities, nationally as well as globally. Now, in case some of you are a little bit nervous about your future, public health does offer you lots of career options and opportunities. You can choose to become a specialist in a particular disease category, such as infectious disease or chronic disease or injury prevention, or you can become a public health generalist and use your skills to contribute to a number of different focus areas or cross-cutting service areas like policy, public health surveillance, or informatics. Personally, for me, I chose to be a public health generalist because I'm the kind of person who always likes to learn new things, so working in public health has allowed me to do that. During my career at CDC, I've had the opportunity to make contributions to environmental health, birth defects prevention, health education and training, as mentioned, emergency preparedness and response, public health surveillance, and I've even managed to stay involved in mental and behavioral health projects, which has allowed me to stay connected with my roots in psychology. So this flexibility has provided me with a wealth of experiences that I would not have had if I had chosen another career path. Public health is a wonderful career, but let me warn you, it's not without its challenges. There's never enough funding, and there's almost always red tape and bureaucracy, especially if you choose a career at the local, state, or federal level. So my advice to you is to learn to be resourceful and innovative and to learn to work with what you're given. As, excuse me, as CPH graduates, I want to say that you are now well equipped to go forward with your career in public health. Whether you decide to work at a local, state, or federal level, whether you decide to work for a non-government organization or nonprofit or wherever, you are prepared. Excuse me. And the reason that I know that you're prepared is because your faculty and your curriculum have prepared you well. You now have a strong science background. You know how to think about and analyze situations using evidence. You've learned to be curious and to ask questions. You've learned to recognize the contribution of diverse perspectives. And you've learned how to plan, implement, and evaluate public health programs. So you are a lot more prepared than you probably think you are. So as you transition from campus life to a professional life, I hope that you will continue with your career in public health. But if you don't, I can assure you that the skills you've acquired here at CPH can be applied to many other fields as well. As you leave CPH for the professional world, I'd like to share with you 5 tips for a successful career. Now, these tips could be applied to any career, but I think that they are especially important for public health. And I'll do a countdown. I'll start with number 5. So the 5th tip is career success doesn't happen overnight. Be patient with your career. Don't get discouraged. The road to success is almost always a wavy line. Rarely do you graduate from college and then immediately, boom, go straight up to the top. Expect some bumps in the road and be prepared to deal with these. Always have a plan B, but never forget your plan A. The 4th tip is it's not about being the smartest person in the room. Because trust me, this is public health. There's probably always going to be somebody smarter in that room. And if you try to act like the smartest person in the room, you're probably just going to come across looking like a jerk. So don't do that. Instead, you want to be the person in the room that's willing to go the extra mile, willing to listen to other people's views and perspectives. Be the person that's known for getting things done. Be the person that's willing to step up to the plate and not whine about it. Okay. And that whining is really important, or not whining is really important. Okay. The 3rd tip is keep your skills up to date. From my observation, those who've been most successful in public health are those who've kept their skills up to date, or they're continuously learning new things. I know that many of you are eager to leave the classroom, but you need to remember that the world is constantly changing, and the public health threats that we face today will most likely be different in the future. I mean, who would have ever thought that we'd be talking about opioid addiction as a public health crisis? But we are. So things have changed. When I started my public health career, conversations in public health were always around epi and surveillance. And we still talk about epi and surveillance, but now we also talk about public health informatics. We talk about health economics. We talk about evaluation and certainly preparedness and response, but also behavioral health as well. So keep your skills updated and always be thinking about and looking for what you need to do to be prepared to deal with the next public health threat. The 2nd tip is network, network, network. Networking is essential for your career growth. And networking is about building relationships. It is not just the number of connections on your LinkedIn account or on your Facebook page. And the only way to really effectively network is to increase your visibility. So you need to volunteer, you need to join work groups, committees, professional organizations, and participate in person as much as possible. And I know that's probably a scary thought for some of you because you're used to doing everything on social media, but trust me, nothing beats that old-fashioned face-to-face when you're trying to build your career. And since I mentioned social media, for goodness sakes, please kind of clean up your social media accounts. Prospective employers will check you out. And we've all been college students, and we know what college students do, but trust me, your prospective boss does not want to see it on Facebook. Okay. I'm glad they didn't have social media when I was a college student. But there's some old Polaroids around here somewhere, so. All right. So, but the number one tip that I'm going to leave you with, and what I think is probably the most important tip for a successful public health career, is soft skills matter. And by soft skills, I mean people skills. These are the skills that you're going to need to communicate and get along with others. It's your work ethic. It's your attitude. It's your communication skills and your emotional intelligence. And some examples of these important soft skills are communications, that's both oral and written. Communication skills can be learned and improved with training. So if you need some work in that area, make sure you do that. Teamwork and collaboration is essential in public health. Rarely will you be in a position where you will just be isolated and working by yourself. You're going to be working with teams of people, and it's most likely going to be a diverse team of people who don't look like you and don't talk like you. So you've got to be a team player. Problem solving and resourcefulness. You got to be able to make quick decisions, think on your feet and solve problems. And again, find a way to get things done with what you've got, because resources are often very limited. And flexibility. You got to bend, be able to adapt to change. And so I want you to remember this last thing that I have to say, and again, if you don't remember anything else that I've said today, but your resume and the hard or technical skills that you've acquired here at CPH may get you that interview, but it's going to be your soft skills that will often determine if you get that position or if you're able to keep that position when you go forward. So soft skills are essential for your career. In summary, you've received a wonderful legacy. UGA legacy, CPH legacy, public health legacy. So wherever you go, whatever path you follow, I wish you the best of luck. And again, welcome to the public health family. Thank you.
Thank you for that excellent advice for our graduates. Now we'll have our student speaker, and he is Jamarcus Mathis, and I invite him to come to the stage. It may be a surprise to his family because he did not tell them that he was going to be the student speaker. So they... Jamarcus is from Tyrone, Georgia. He finished high school at Sandy Creek High School. He's one of four children, and he owes his success to his strong family, who molded him into a dedicated and caring individual that he is today. After graduating from high school, he entered UGA as an honors graduate program. He is a Thoreau honors scholar. Throughout his time at UGA, he's not only been a dedicated student, but he's been active on within many campus organizations. He was vice president of the Black Affairs Council. He was director of health and safety for designated dogs. He was president of the College Town Gospel Choir. He received the Department of Multicultural Services Program's Community Service Award, and just recently he was inducted into the Blue Key Honor Society. While he was in the... Wow. Multiple ovations here. During his time at CPH, he worked with Dr. Phaedra Corso and Dr. Carolyn Lacker, and he's co-author on a current publication within the American Journal of Men's Health. After completing his internship at Emory Healthcare this summer, he'll be receiving both his Bachelor's of Science in Health Promotion and his Master's of Public Health in Health Promotion, and he did it all in 4 years. So welcome.
Wow, it's a lot of people. Okay, well, good afternoon, everyone. I'd like to first thank you for coming to the University of Georgia's College of Public Health's commencement ceremony. I won't lie, it was pretty difficult writing this speech. Don't get me wrong, I was completely honored and ecstatic to have been chosen, but I just did not know what I was going to say. However, if there's anything that college and life have taught me, it's that you make it happen. So after some internal deliberation, I decided that I'd start with a quote and see how it went from there. Kind of cliche, I know, but here we go. The meeting of two eternities, the past and the future, is precisely this present moment. Henry David Thoreau. When I found this quote, I felt that it was the perfect way to summarize our college experience. Quite honestly, it feels like our entire lives have been a culmination of experiences leading to this moment right now. We did everything we could to get into college, then we did everything we could to graduate, and now the rest of our lives are sitting in front of us, and it almost feels like we've just been waiting for right now. But that's no way to live, just waiting. Just waiting until our next vacation, just waiting to get that next new job, just waiting to be doing something different than what you are right now. Essentially, if the entirety of two eternities meets at this exact moment, then don't be too obsessed with eternity to not enjoy the gift that is the present. From lectures with Dr. Orpinas, where she vehemently inspires the class to get others to show you the data, to the collective drainedness and mind-boggledness that is the community health final. From all-nighters spent at Rhodes Hall to try and finish your literature reviews, to sitting in on a class all semester that you hadn't even registered for just so you could see your friends. From experiencing a new country and becoming obsessed with Kumamon, to hearing and experiencing, to hearing and answering what feels like the millionth time, what even is public health? The point of those short representations of just a few moments characterizing our experiences here at UGA, other than to shamelessly shout out a few friends and fellow graduates, was to help drive this point home. College, whether undergraduate or graduate, is of course about getting our degrees so that we can find some kind of job that allows us to start adulting, but even more importantly, how to live in the moment and not take a single one for granted. Class of 2018, it's our turn now. Our turn to tackle the world, grab the bull by its horns, plant our feet, and get it done. Just remember, you shouldn't have to stop and smell the roses because that means at some point, you forgot about what's really important. Thank you, and Wakanda forever.